Initially, I was skeptical about how the visualization and image quality on the Elara slit lamp would be different to the BQ900 slit lamp. As soon as I examined a patient for the first time with the Elara 900 slit lamp, when looking at that corneal slit, the view just popped. I suppose I was very much pleasantly surprised that there was a definite improvement in that visualization. The reality is that this slit lamp has been completely redesigned from the ground up. With the Elara slit lamp, this leverages that new projector, that P-type illumination, so light is shone directly onto the eye, and that removes a source of aberration from that visualization. The other thing is, this DLP illumination, this projector illumination, provides projection of individual pixels onto the eye and very clear and focused projections of the color spectrum onto the eye. And that means for all the structures within the eye, we have an optimized examination, and this provides greater clarity, detail, and contrast. At the Royal College of Ophthalmologists Congress earlier this year, we actually ran a small pilot study to evaluate how clinicians reacted to the quality of visualization when examining patients with the Elara slit lamp. And that was really interesting, and we're going to be publishing that in a white paper later this year. 70% of doctors said that there was improved visualization, 30% said they weren't sure if there was a difference, and 0% preferred the traditional slit lamp as well. The other feedback that I've had from clinicians is that with the presets that you have in the Elara slit lamp, when you go from, say, cornea to anterior chamber, rather than having to twiddle so many buttons and dials and options on the slit lamp, just turn one dial a fraction of a centimeter. And that means you're quicker, you're more efficient, and you're actually more comfortable. For me, the biggest thing that reinvents the use of the Elara 900 slit lamp and slit lamps generally is the fact that I have a screen right in front of me on the Elara slit lamp. I can capture my photos and videos, and within 10 seconds from taking those photos and videos, I can search that patient's hospital number, their surname, their details, and send all of that information straight to the medical record. Imagine if you could have that same workflow that you have when you take your photos of your food and take that and send that to Instagram. Imagine if you could have that same workflow with the slit lamp. That's what the Elara 900 brings, and I think that's the most powerful change that we're going to see in our slit lamp examinations. But also, it's inevitable that we're also going to have the benefits from artificial intelligence in our slit lamp imaging workflows, and also have greater diagnostic capabilities through this as well. But the Elara brings digitalization to each consultation for the slit lamp examination. And when we bring that digitalization, that imaging capability to every consultation, we're able to leverage all of these benefits. So more confidence in our clinical decision making, better education for our patients, and also supporting training for our more junior doctors. We're going to help them to develop their ophthalmic clinical skills and really work their way through the learning curve in a much more efficient and safe way. For me, I'm obviously biased. I love slit lamp imaging. I have a slit lamp YouTube channel, so check it out if you haven't seen it already. For me, there's no doubt that slit lamp imaging has an incredible potential to change the way we practice. That workflow with the presets, that new illumination, and that new way of working, I think it's that way that provides that new breakthrough way of working with the slit lamp.